So this is the latissimus dorsi. We can see the very bigger muscle. This muscle is having connection with the sacrum bone. We can see here. This is the sacrum bone. So this is the sacrum bone, and latissimus dorsi attached here. Means sacrum is the lower part of the spine. And this is the hip bone. We can see on the side. Both side hip we can see here. So the latissimus dorsi also attached with this hip bone. This is the very important bone, hip bone, right? So in this way we can see. Now latissimus dorsi is also having connection with the ribs. We can see there are multiple ribs are connected. And also it's connected with the spine. We can see here with the thoracic 7 onwards. thoracic 7 के बाद ये connected है. अब देखिए इतनी सारी जगह connected, but ultimately if you see the latissimus dorsi, you can see how this muscle is attached with the humerus bone. हमारे हाथों की humerus bone से attached है. We can see the connection. This is the connection of the latissimus dorsi. हमारे arm की humerus bone से connected है. So these are the multiple connections of the latissimus dorsi we can see in this image. That's why when we are moving the arm, we are also moving latissimus dorsi. जब आर्म को मूव करते हैं तो latissimus dorsi भी मूव होती है. The another important muscle here, that is gluteus maximus, buttock muscle. We can see this is the bigger muscle, buttock muscle, gluteus maximus. So we can see how this glutes or the gluteal muscle. The gluteal muscle also having connection with the sacrum bone. हमारी sacrum bone से इसका गहरा connection है. This is the sacrum bone, right? So it is attached with the sacrum bone. So now if the gluteus muscles is contracting, it will affect the sacral bone. अगर इस मसल में कुछ भी कॉन्ट्रैक्शन होगा तो sacral bone प्रभावित होगी. In the same way, the latissimus dorsi muscle is also having connection with the sacrum bone. From the lower side, gluteus muscle, the buttock muscles having connection with the sacral bone. So now it's if there is any problem in these two muscles, it will affect the entire structure. Under sacrum है हमारा. Now look at here. How these muscles are holding the sacrum. From the upper side and from the lower side. That's why we are telling if the latissimus dorsi and the gluteus muscles are contracted, they will provide stability to the sacral bone. ये दोनों मसल ही हमारे सैक्रम को स्टेबिलिटी प्रोवाइड करती हैं from the back side. If a person want to stand properly, then these muscles are contracted and person can stand perfectly all right. अगर ये दोनों मसल ठीक से काम ना करें तो व्यक्ति का ठीक से खड़ा होना डिफिकल्ट है. There will not be any stability in the spine and especially in the sacrum bone. So we have seen up this is the latissimus dorsi and here is the glute. They are having very wonderful connection with the fascia that is called thoracolumbar fascia. So these muscles and the fascia together providing stability to the sacrum bone. हमारा sacrum bone की stability इसी से होती है. We can see the sacrum, very important bone. Many person are suffering with the lower back pain. So this is the back part of the sacrum bone. We can see from the back side. This is the front part of the sacrum bone. So sacral stability provided by these latissimus dorsi and Gluteus muscles, these are called sacral foramina. इन्हें हम sacral foramen कहते हैं. From here, nerve are passing, they are making sciatica nerve. And we know sciatica nerve is a very important nerve. From these holes, nerve are taking exit. Nerves are coming from the spine, then taking exit from here and going in the leg. So this sacrum bone is very much important. If there is any problem in the sacrum bone, if there is any compression around, then person will be suffering with the lower back pain or the thigh pain, leg pain, sciatica pain. There are multiple problems might happen. Sacrum bone is very important. And sacrum bone always do a very, very rhythmic movement. सैक्रम बोन की एक बहुत ही अच्छी मूवमेंट होती है जिसे हम रिदमिक मूवमेंट कहते हैं. When the sacrum bone go anterior, this is the movement number 1. When the sacrum bone go posterior, this is the movement number 2. Do you know what is the name of that movement? कि जैसे कि हमने देखा कि ये हमारी sacrum bone है. So there is a one movement sacrum bone is doing like this, and one movement sacrum bone is doing like this. Natural movement. So this movement, when the sacrum bone is doing like this, so lower outlet will be bigger. So gas will pass. If someone is having gas in the intestine, open the outlet. Gas will pass. Want to deliver the child, open the outlet. So if the lower outlet want to open this movement, so this movement is called nutation. 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 Nutation means opening the lower big, like the lower outlet becoming bigger. That is called nutation. And this opposite movement called counter nutation. Like there is a one movement, you might be knowing that movement called Pavan Muktasana. In the Pavan Muktasana, this lower outlet is increasing. Pavan Muktasana जानते हैं आप? Movement. So lower outlet is increasing. Means nutation of the sacrum bone. Then it's a very good posture to increase the lower outlet so that gas is passing, or it is called Pavan Muktasana, or whether the gas is passing or not. It's a good posture if someone is suffering with the indigestion, constipation, right? Even for the lower back pain. Why? Because it's a very good point for, it is very good for sacral bone. So we can do एक पाद पवन मुक्तासना. In this position, we can see the nutation, the increase of the lower outlet. This is also Pavan Muktasana. And this is from both leg. And if you see the piriformis muscle is here. I will show you how it's very closely connected with the sacral bone. The nerve is coming out from the sacral. They might compress under the piriformis. तो पायरिफॉर्मिस मसल में कंप्रेस हो सकते हैं वो मसल नर्व्स. So piriformis muscle is located here. We can see this is the piriformis. It's in the anterior side. Got it? Sciatica nerve is the this nerve, very thicker nerve. Sciatica nerve. We can say bilateral. This is the sciatica nerve. It's a very thick nerve. See the origin of this nerve. How it's coming out from these holes. These are the multiple holes. From the holes, the multiple nerves are coming out. So it's this is the S1. Upper one is the S1, spinal nerve. Then the S2 spinal nerve, S3 spinal nerve, and few more nerve are together making this sciatica nerve. And here we have piriformis muscle. यहाँ पर piriformis muscle भी है. So it might create some problem. ये कुछ ना कुछ problem create कर सकती है. It might create some nerve compression. So we are doing in this way. First, we are comfortably coming in this position, right? Now we are bending one leg and bringing in between both the palm. You can see in this way, right? The other leg we are stretching back. And just we sit like this is the variation number 1, Kapotasana. We can do that. Or just keep in that. This is the, or keep in that. This is the variation number 1, pigeon pose. It's a wonderful exercise for piriformis syndrome causing sciatica pain. Right? Just hold in this position for a while. We can do from the other side. There are many variations of this. So again, we can keep in this position. Make sure you are stretching the leg who is on the back side as maximum as possible. Now, if you be in this position, if you hold this position for a while, then you will start feeling a stretching effect on the piriformis muscle, and it will relax your piriformis muscle. So contraction of the piriformis muscle will go away, and you will be feeling relaxed. There are many variations, but we are not going for the variation. How many person able to do this? Able to do, wonderful. Can do this? Great. This is called pigeon pose or Kapotasana. We have done the other exercise for the piriformis already. This is piriformis stretch, just we have done, right? And no lower one is the knee to chest. It is like our Pavan Muktasana, knee to chest. We have done. This is the pigeon pose. This is the advanced version of the pigeon pose. We can also lean our head downward. So now our main focus is our piriformis muscle, right? हमारा मुख्य फोकस क्या है? Piriformis muscle. So piriformis muscle is the muscle located on the front side of the sacral bone